Nebulizer therapy can be given regardless of age, even to young infants, toddlers, or the very elderly. Only tidal breathing is required, so treatments can be given regardless of disease severity or acuity. For example, during severe exasperations, the breath holding required for metered dose or dry powdered inhalers is very difficult. Large doses of medicine can be administered. For example, the typical nebulized dose of albuterol is 2.5 to 5 milligrams versus about 100 micrograms per puff of albuterol from a metered dose inhaler. So many puffs from the inhaler would be required for a similar dose. There is no hand dexterity or strength required to inhale during the treatment. On the other hand, what are some important considerations in selecting inhalers over nebulizer therapy? Low efficiency of drug delivery by jet nebulizers. A significant portion of the dose does not reach the lungs. First, continuous nebulizer treatments emit aerosol throughout both inspiration and exhalation. As a result, 50 to 60% of the emitted aerosol is lost in the atmosphere. Of the portion that is inhaled, ultimate lung deposition is very low. It varies widely from 1 to 15% of the total dose. The lung deposition will also vary between brands of nebulizers and even within the same brand. When using a mask in neonates and infants, as little as 1% may reach the lungs. Some manufacturers of nebulizers are attempting new designs with new features to increase efficiency of drug delivery. For example, some will emit the mist only during inhalation. The medicine and the residual volume at the end of the treatment is wasted. Approximately 25 to 50% of the initial solution volume remains along the walls and in the reservoir of the jet nebulizer after treatment. The less efficient the delivery system and more drug is wasted. By diluting the drug dose with normal saline, the concentration in the residual volume is decreased. If the residual volume is 2 milliliters, likely 1 milliliter is drug and the other 1 milliliter is normal saline. In comparison, the lung delivery by some newer hydrofluoralkane inhalers can be around 50% of the total dose. It takes more time to administer a nebulizer treatment. As mentioned before, a nebulizer treatment can take between 5 to 15 minutes. In comparison, inhaler therapy may only take a few moments. Many patients mistakenly will continue a nebulizer treatment until the cup is dry or past the sputter point, which will unnecessarily lengthen the treatment even more. Nebulizer therapy is less portable and can be noisy, but newer models are becoming smaller and quieter. Some can fit in a purse or the palm of your hand and weigh less than a pound. Many can run on batteries. Cost of nebulizer therapy is more than inhalers. Nebulizer solutions, particularly those in single-dose packaging, are more expensive. There is also the expense of replacing the tubing, filter, and nebulizer parts. If medically necessary, most insurance companies will cover a portion of the initial cost of the air compressor and the nebulized medication. Maintenance and cleaning of nebulizers is more involved and can be cumbersome. Without careful maintenance, the risk for infection increases and the efficiency of drug delivery decreases. One study showed that 24% of patients never cleaned the nebulizer parts. Most that did clean them were not disinfecting them correctly. Patients, even some healthcare professionals, have a misperception about nebulizer effectiveness. Nebulizers are not more efficacious than equivalent drug delivered by a metered dose inhaler. So, if patients are able to perform correct technique and an equivalent dose is given, metered dose inhalers are as or even more effective than therapy given by nebulizers. For these reasons, nebulized therapy is usually not the first choice if other devices can be used. Very young patients may require nebulized treatments, but as they grow, therapy can be transitioned to an inhaler with mask, an inhaler plus holding chamber, and eventually either a dry powdered or metered dose inhaler alone. Healthcare professionals can encourage cost-effective therapy by encouraging inhaler use when appropriate.